Welcome back to In Session, deep dive into healthcare policy we're bringing to you every week from our team on the ground, the State House. I'm Ryan Bernal, Vice President of Government Relations for the South Carolina Hospital Association. And here's the rundown for week 14. We've got 12 legislative days left. And with that, the House and Senate are sending their last volley of House bills and Senate bills to the opposing chamber. So House took a final shot at some House bills to pass over to the Senate, and the Senate did the same with some of the Senate bills they'd like for the House to debate before the end of session and the sine die on Thursday, May 14th. Now, a lot of our attention this week was on the Senate Finance Committee passed budget. The Senate Finance Committee met last week, and the Medicaid budget is a little bit shorter than what the House passed and shorter than what the agency has requested for their maintenance of effort. So while that has us concerned because that could lead to some significant hospital rate cuts if not fully funded in the end, there is an art to budget craft, and we trust that the budget writers are posturing those budget lines in a way that will allow them, as they advance to a conference committee and ultimately to the governor's desk, to increase their Medicaid funding recommendations and take the higher of the two versions between the House and Senate, depending on which allocation you look at, and get closer to the 185, if not the full 203 million. So we're staying focused and engaged on that, and look for more updates as we have them to share, and potential calls to action to ensure that both chambers understand the importance of those dollars and get that to the governor's desk. Speaking of Medicaid, there was also a Senate Judiciary Committee hearing last week related to Medicaid provider fraud in Senate Bill 915. And the senators welcomed Director Eunice Medina with open arms and high accolades and praise for all her and her team and the agency are doing to combat provider fraud. As discussions around waste, fraud, and abuse bubble up nationally and at the state level, we're grateful that the Medicaid agency here is under the stewardship of Director Medina, and they're paying attention in ways that allow for appropriate crackdowns but avoid unintended consequences that might negatively impact hospitals and other providers. For our hospital bed effort and the rural emergency hospital designation, really grateful to see the House version of hospital beds pass out of the Senate, and the Senate Medical Affairs Committee, and the Senate version of the rural emergency hospital designation seems to be on track to be recalled to the House floor and passed out next week. Some good conversations with leadership on both sides over the last 2 weeks to get those across the finish line, and we're grateful for that. The Medical Affairs Committee will reconvene next week as they take up the House itemized billing bill, the patient-friendly billing bill, for transparency. We've been working with the sponsor and the committee to ensure that that language provides the transparency a patient needs and deserves, while also not creating an overly burdensome administration requirement for hospitals to provide that information. Looks like they're also going to debate some abortion language in a Senate bill, so we'll be paying attention to that as we want to make sure that there are no criminal penalties applied to our providers. Last of all, really want to give a shout out to the SCHA team, to all of our hospital CEOs and leadership for our annual legislative luncheon at the State House ground. A tremendous showing by all of our hospitals. Unfortunately, timing wasn't on our side, and by the time the Joint Assembly ended, most of our hospital execs had to go back and do their jobs. But fortunately, we were able to stick around and welcome a good majority of the House and Senate members, including the Senate President and House Speaker, for some fellowship and lunch and some dialogue about some of our priorities. So real thankful to all the legislators, all of our hospitals, and the SCHA team for all of their work to pull that off. Really impactful. McLeod Health was on the grounds this week for our Hospital of the Week. They also hosted a legislative reception, so grateful for their CEO, Donna Isgett, and her entire leadership team. Next week, we look forward to welcoming Tenet Health. And with that, we'll see you next week for week 15 with the last 12 days of session. Thanks.